This is a case of a 65-year-old gentleman who was diagnosed with a nodal marginal zone lymphoma in November of 2014. When he presented with diffuse adenopathy, and he came to his doctor because of lymph nodes in his groin that he was palpating. Upon initial exam, his physician found that he had diffuse adenopathy not just in his groin, but also in his axilla, in his right axilla, as well as in the bilateral groin. He was noted to overall feel generally well without too many symptoms, and his past medical history was negative for any significant medical histories such as cardiovascular disease, diabetes, and otherwise a generally healthy gentleman. Upon initial lab work, he was found to be negative for HIV as well as negative for hepatitis C and B. And initial lab work really just showed a mild neutropenia, about 900, but nothing other significant and no other major abnormalities on his blood work. He was recommended for a biopsy, at which point biopsies of the groin node revealed that it was a B-cell malignancy. It expressed CD19 and CD20 really only, and was negative for other common markers that are evaluated. And baseline imaging revealed diffuse adenopathy as well. That was confirmed in multiple nodal sites, but it was noted that most of these nodal sites were less than 2 centimeters. And given that he was feeling well, the recommendation from his physician was to continue to monitor him and observe him with physical exams and imaging going forward. In November of 2015, he was noted to have disease progression. He felt lymph nodes growing in his arms, in his axilla, as well as in his groin. And at that point, his physician had discussions with him about treatment options, and the decision was made to initiate chemoimmunotherapy with bendamustine and rituximab. The patient did relatively well, had a decent response, but unfortunately 2 years later, he did have a relapse and again noted to have enlarging lymphadenopathy. Given that he had relapsed relatively in a short amount of time, within about 2 years, at this point it was decided not to re-challenge him with bendamustine rituximab, but that his physician recommended a more aggressive regimen with R-CHOP. He received R-CHOP, all 6 cycles, and at the end of treatment was noted to only have a partial remission at that point. Given that he had just gotten chemotherapy, was in a remission, was feeling a little better, he was recommended to just continue to observe the disease. Unfortunately, this remission was also shorter than the previous one, and 7 months later, he came back to his physician and again noted disease progression with enlarging lymphadenopathy and return of symptoms of fatigue. Again, at this point, his physician and the patient had several decisions to make, and at this point the recommendation was to initiate third-line treatment with a drug called ibrutinib. He initiated the drug and tolerated it relatively okay, but had some complications with diarrhea that resolved with over-the-counter. He had noticeable bruising and throughout treatment, but no significant major bleeding. And his course was complicated as well by a neutropenia, at which point the drug had to be held. And the neutropenia then resolved within a short amount of time and then re-challenged at the same dose, and the patient continues on this therapy.